Dr. Carol Odom Walker, the Secretary of the Delaware Department of Health and Social Services, was on hand Wednesday, August 14th, as Delaware's Division of Public Health released its drug overdose mortality surveillance report for 2017.
For Delaware. This report today is an incredible accomplishment that we're excited to celebrate together. For families who have lost loved ones to overdose, the pain is immense and the memory is everlasting. And it's a constant reminder to us at the state, every time we see another death, that we have more to do. We continue to mourn those that we've lost. We have a responsibility to examine the patterns in overdose deaths in our state and determine what we can learn to reduce the impact of this epidemic going forward.
Lieutenant Governor Bethany Hall-Long said she was thrilled that so many state agencies were able to pull together and provide critical data related to behavioral health for this report.
Every day in our state, 30,000 adults, 9,000 children, I'm going to say that again, 30,000 adults and 9,000 children wake up with some underdiagnosed or diagnosed mental health condition. And every 22 hours, think about that, every 22 hours we are losing a Delawarean to an overdose death. Not acceptable.
Hall-Long chairs Delaware's Behavioral Health Consortium. Division of Public Health Director Dr. Carol Rattay pointed out the report, an integration of 12 multi-agency data sets, paints a demographic picture of the Delawareans who died from drug overdoses in 2017, as well as addresses the types of drugs used, if, how, and when those who died interacted with Delaware health systems, and provides a description of key statewide efforts to address the drug overdose and substance use crisis.
This report is to better understand those who have lost their lives to addiction, to overdose deaths, so that we can shape our efforts moving forward.
An example of the data found in the report, a large majority of the persons who died of a drug overdose in 2017 interacted with the Delaware health system in the year prior to their deaths.
Maybe it's surprising, maybe it isn't, but 80.5% of individuals who died in 2017 interacted with one or more system in the year prior to their death.
Framework that measures those client outcomes. So this data that you guys have provided...
Elizabeth Romero, Director of the Division of Substance Abuse and Mental Health, said the report confirms that the efforts made so far under the START initiative are moving our system of care in the right direction.
And this report provides that crucial information that DSAM and our partners need to gain insight into how those substance use disorders are interacting with those entry points, and like threads that connect those entry points systematically to quality treatment and wraparound services and supports. So often, sometimes it's about who you call that gets you connected, and what we want to say is everyone has a fair chance to get to the system of care. So these threads are so critical.
There is no question that we have more work to do up and down our state to reduce the toll of the opioid crisis in our state. And thousands of individuals and families affected by this chronic and complex brain disease will benefit from our work.